Hello, my well-being buddies. It's Steve, the mental health nurse, and today we're going to be talking about anxiety. And I think this is a really important topic to talk about because all of us, no matter who we are, we can get anxious from time to time. And very much like the previous episodes, it's a scale. And what we shouldn't ever do is eradicate anxiety. It is a normal response. It's no different to us saying we're happy, we're sad. Anxiety needs to be there. It's our inner core warning system that something's not right. So if we medicate, if we get to this emotional numbing state, then potentially you're missing important warning signs that the body's telling you. So let's see what we're going to cover today. So we're going to be looking at what anxiety is, the causes, some risk factors around anxiety to be mindful of, understanding those signs and symptoms of anxiety, have an understanding of how it's assessed from a primary healthcare point of view, look at some of the natural ways of managing anxiety, and then finally looking at other medication options. So let's start off with what is anxiety. So anxiety is a feeling. It's when you feel worried and your body does an amazing thing. It gives you lots of signs and symptoms. And basically, it's your body warning you that something's not right or something is wrong and you need to be mindful of it. It is a natural human response, okay? But again, I understand that there are scales here that we need to be wary about. So we know that for most people, from time to time, we get anxious, we can manage it, and we learn to deal with that. And therefore, we learn things like coping skills. And that could be things like stressful events. So like I'm at school, I've got a presentation to do. I need to learn some of those coping skills to manage that stress. So that's where we're at. But if anxiety gets out of control, it can be quite crippling. It can turn into a panic attack. We get the over breathing, the hyperventilation, and we can turn into that response, those three Fs, the fight, flight, or freeze response. And again, very much like an animal response, it tells us, and the way that we react is our psychology to what's going on around us. So we obviously want to make sure that anxiety is there, we recognize it, we understand it, but equally, we need to understand when it becomes a real problem. So when is anxiety a mental health problem? Well, it's a little bit difficult, this one, but anxiety can become a mental health problem if it impacts your ability to live your life fully. So, for example, here, we're looking at, have you had it for a long period of time? Do you fear and get worried? Is it a normal amount of fear or worry per situation that you're in? Is it a normal response to what's going on? And if it's not, we then may need to look at that. And that's when it becomes a real problem. So if we look at what anxiety feels like, then we get an idea about how to recognize it a bit more. So we have our signs and symptoms. So signs are things that we see, symptoms are things that we feel. So we may feel our stress levels rising. So we may feel this adrenaline coming in and we're feeling a bit overwhelmed. So we get this a wave of emotions. So that could be a feeling that you feel. You might feel your heart rate increase. You might feel your dry mouth. You might feel that you're getting shaky. You might feel that you're getting a bit sweaty. So they're all the things we feel. And then what we might say to somebody is, oh, I can't cope. I need to get out. And the way that we're talking just comes across in a bit of a panicky situation. So that's kind of recognizing some of those signs and symptoms there to the anxiety. So the reality is, what we need to ask ourselves is, what causes anxiety? You know, what is the main trigger there? And from that, how do we manage those signs and symptoms? And the reality is, from the causes here, we can see that it's a coping skill. So it may be that we just didn't learn the right coping skills at the right time. And that may be an indication of a neurodivergency. So is there an underlying autism thing here, or ADHD, or is there some kind of intellectual disability or neurodivergent condition there that needs to be looked at? It can come from our learned experiences, so things that we've been through that have traumatized us. And trauma is a really powerful thing. And we'll talk about trauma because that does really kind of link quite strongly to anxiety as well. We'll talk about that in a minute. It can come through life situations. So, for example, you may just feel overwhelmed and your ability to cope and your resilience is becoming a lot poorer. You may have physical or mental health problems. So that overthinking, that spiraling, rumination, constantly worrying about something. Or indeed your physical health is getting worse and therefore your anxiety is now becoming more health-related anxiety and that's causing problems. Or equally, it could be related to drugs and medication. So again, constant drugs and medication, increasing your heart rate and stress and trauma to the body. And that's obviously creating that anxiety piece. So our past and childhood experiences are obviously all different, and that's what creates our personalities and who we are. But if you have gone through some problems as a child, and that might be through stress or through trauma, then this is going to impact you for a long period of time of your life. And therefore, you may have physical or emotional abuse that then is going to be holding there. And your fight, flight, freeze response is going to be very different to somebody who's not experienced that. If you've been neglected, so if that's accidental neglect or willful neglect, where somebody's deliberately neglected you, that's going to put your emotional state in a very different place. So that anxiety piece needs to be worked on, the trauma bit. You might have lost somebody. So it's that abandonment, that loss, that grief that has created this anxiety. You may have been bullied at school, and that's quite a common one, or bullied at work. And then that causes social anxiety, being out in the real world and facing all of that. Or alternatively, you've had some kind of discrimination. And that could be racism, ageism, sexism, homophobia. It could be a list of any of those protected characteristics. And all of those past experiences creates us who we are. Then we've got our current life situation. So our current life situations looks at things such as our day-to-day stresses, lots of changes if we're not very good with change, dealing with uncertainties, working under pressure. It takes a certain skill type to constantly work under pressure. Doing long hours. When we work long hours, our body gets fatigued, we get exhausted, our brain burns out, our body burns out, and it just leaves us in a much more fragile state. Being unemployed clearly causes anxiety because where does the next lot of money come from? How are we going to pay our bills and food, etc.? So lots of social issues there in which we can think about later when we look at treatment. Housing problems and homelessness. So again, lots of social issues there create some of that we can go back to think about how we can treat this. And again, things around being abused and stuff like that. If we go back to our physical and mental health problems, so physical health problems, long, serious, on life-threatening conditions, maybe such as asthma, for example, could trigger anxiety. So if someone's going to ask you to run and you're worried that that's going to trigger an asthma attack, or you're doing a long day and you've forgotten your lunch and you're diabetic, and then that's going to trigger your overthinking and worrying about your physical health problem. And equally, mental health problems. So you may be worried that people can see it and that you're trying to mask it or hide it, or you're just worried about this overthinking piece. That seems to happen a lot. And or then drugs and medication. So if you're self-medicated or if you're taking other medications, then you could be worried about that as well. So there's lots of things there that can trigger anxiety as a problem. We've already talked about some of the signs and symptoms in which you're going to feel and see, but equally, the other ones there to think about are going to be things around your stomach. So when we feel that stomach crunching and that nausea, that's the first warning signal from the brain saying, look, something's not right. I'm going to prepare for fight, flight, freeze mode. I'm letting you know that you're going to be sick or you're going to feel sick because we're going to shut the organs down and we don't need your stomachs. We need you to preserve energy ready for this fight, flight, freeze. So that's why we feel sick. You might get headache and dizziness. Again, something to do with blood pressure. So the highs and lows, pins and needles. You may feel restless because you've got to pace because, again, it's this oxygen level going in and out. You may get pains. You may feel your breathing's going faster, sweating, sleep problems, grinding your teeth, nausea we've just covered. You may feel that you need to go to the toilet. You've got constant worry there. You may find a change in your sex drive, or alternatively, you may be having a panic attack. So what is a panic attack and what does that feel like? Well, a panic attack can be a real physical symptoms and they can build up really quickly and it can feel really distressing. So a lot of the patients that I've seen have gone to cardiology because they feel that they've had a heart attack and they're worried that maybe they've had a stroke, and actually it was an anxiety panic attack. And that's because you get this pounding heart rate and up across your shoulder, it can feel like a real tightening of the muscles up here, and everything gets really stiff. You can feel faint, dizzy, sick. You can start to shake. You've got pains in your chest and abdomen. You can feel that your breathing is feeling like it's being choked. Your legs turn shaky, your arms turn shaky. You've got this pins and needles feeling. And sometimes people can do what's called dissociate. And dissociation is where almost your brain just shuts down and you have a moment of absenceness because the brain's just gone, no, I can't deal with this. I just need some time out. So during your panic attack, you may feel afraid, and that's because you're losing control. You may feel fainty, that you're going to have a heart attack, and it feels like you're going to die. And again, none of those things hopefully will happen. It is all about learning to manage those symptoms, recognizing them, getting early recognition for early treatment, because that's what's really important here. So how is it assessed? How do I know if I've got anxiety? So again, when you go and see your doctor or your mental health practitioner, they're going to ask you some questions, again, just about your background and your health checks. And then they may do a screening tool with you, which is called the GAD-7. So that stands for the Generalized Anxiety Disorder, and it's a screening tool. And this screening tool will look at the severity of your anxiety. And based on your answers, there is a stepped approach. So if your anxiety levels are reasonably low, we may do what's called watchful waiting. We're just going to sit back, see how you go. It may be that you've got this and things improve gradually with time. If that doesn't work, it may be the case that we step it up a bit, and maybe what we need to start doing is looking at root cause analysis. So what's causing this anxiety? Where is it coming from? And let's not forget, anxiety is an umbrella term, and we'll cover this in other videos, but it's covering things like phobia and fear and social anxiety and health anxiety. So there's lots of different types of anxiety under the generalized anxiety umbrella. So again, try to understand where those triggers come from, and that then may involve things like low-level exposure, cognitive behavior therapy, hypnotherapy, anything that helps kind of program the brain to understand why it's doing what it's doing. Or alternatively, you may find a bit of counselling will help with that anxiety piece, because if there was stuff from the childhood that maybe you've been bottling up, you can use that to move forward. You may be recommended things like low-level things to help improve the quality of your sleep. So that might be things like Nitol or sleeping tablets that you can buy over the counter. And again, over the counter, there are herbal medications such as rescue remedies. And all of those medications are designed to keep the heart rate nice and steady and to lower that chance of that panic attack. Now, on top of that, your anxiety levels may be much higher, and at that point, they may need to prescribe SSRIs, so that's the selective serotonin inhibitor uptake medications, and part of that will be the medication plus cognitive behavior therapy. So there should be a combined approach here. So a stepped approach going up to respond to the level of anxiety that you're experiencing. So once it's assessed, once we've got our once it's assessed and once we've got our scale, we can then put together a treatment plan to help you manage that anxiety better. So the natural treatment for anxiety is really going back to coping skills, relearning about your resilience, relearning about how to cope, looking at emotional intelligence. So where does your emotional regulator sit? And some of that you can do online, free of charge, get to understand how you think and feel. That might work. Again, CBT. So you're looking at phone apps, things that help regulate your breathing. So breathing apps are really good for anxiety because what happens is we panic, our heart rate increases, we breathe faster. The faster we breathe, the faster the heart rate, we're in a panic attack. If we can re-regulate the way we breathe, we slow everything down, the heart rate slows down, we avoid the panic attack, and we are very much in control of our body. Equally, it may be things such as distraction techniques. So if you're having a panic attack, you might want to do some grounding skills. And grounding skills, again, might be sensory. You could do the 5, 4, 3, 2, 1 technique. Again, you can look at those online in YouTube. Or alternatively, you might have mantras. And what mantras are? They're positive reinforcement statements. I'm okay, I can get through this, I'm okay, everything will be all right. Positive reinforcement to yourself to reinforce your resilience. So they may work for you. So we've tried breathing techniques, we've tried grounding techniques, and we've looked at some coping skills and emotional resilience skills. There's apps on your phone, so there's sound, there's music, there's distraction. So there's lots of things we can do to help manage anxiety. If none of that's working, we can step that up and again, look at the wider piece. So what is causing these panic attacks? Or what's causing this anxiety, sorry. And again, if we go back to some of these root causes, we can understand the best way to treat them. So, for example, if we're looking at then yourself, I'm worried about the way that I look, I'm worried about the way that I feel, then we can do some self-care techniques. We can reinforce the way we see ourselves. We can do some positive image work. We can self-care for ourselves. We can find some time in our days to look after ourselves a little bit better. So that might be some things that we do there. Equally, if it's the job or employment, then we can look at our employment options. Maybe we can apply for different work. Maybe we need flexibility in our work, or maybe we just need to talk about work. It could be relationship problems. And again, if we've got relationship problems, we may want to go to a counsellor. We may want to talk about this and just try and manage those. Ultimately, we have what's called social prescribing out there. And social prescribing is all about not medicating common mental health conditions, because actually it's a social problem that's put you here, not the mental health condition problem. And what we mean by that is, let's say it's homelessness. Okay, anxiety is a symptom of that homelessness. But if we really want to manage that symptom of homelessness, what we need to do is address the homelessness. So therefore, are you being signposted to the right charities? Do you know your rights around different sections of the Housing Act? Are you talking to the right organisations? Have you got the right help with the right charities? And these are all those problem-solving skills. And the more problem-solving skills we've got, the less we reduce the anxiety and the better we are. I know at the moment with the money anxieties and money worries and food, but equally there are other things that we can do. We can go to charities and look for things like looking at our benefits. Have we got the right benefits? Are we getting the right support? Are there ways that we can reduce our costs? Are there ways that we can save money by cooking differently? Are there different ways in which I can get money into the household. So sometimes we have to change the way we think to get a different outcome. And there's a great phrase out there, isn't there? If you do the same thing and expect a different outcome, then that's the definition of madness. So ultimately, we've got to try different things to help improve the situations we're in. And if we try lots of different things, then hopefully that will reduce the anxiety. From my experience, I speak to a lot of people and they go, but I've tried it, it didn't work. And you're like, but that was one thing you've tried. Not everything that you do is going to work first time round. And ultimately, what we need to be doing is teaching people to manage anxiety and see anxiety in a different light. So let's just say then, we've done all of the skills, we've done all of that stuff, and it's still not working. What else can we do? So herbal remedy wise, or vitamins and minerals, again, a high dose of vitamin B6 works well for managing anxiety. Recent research from Reading University was it concluded that a high dose of B6 helps manage anxiety and depression. You've got those rescue remedies. Sometimes you could try things like promethazine, which is a stronger dose of antihistamine. That can work. 10 milligrams of that can take the edge off of things. Or again, you can use promethazine, 25 milligrams to 50 milligrams at night to help encourage a natural sleep. If that doesn't work, and we've tried everything else now, we've done our CBT, we've done our apps, we've done our breathing skills, we've done our distraction, we've done all of our pieces, we may then be looking for referral. So that might be to our local IAP service, which is the instant access to psychological therapies, or alternatively, you may be talking to your doctor about serotonin, selective serotonin uptakers. So again, that's going to be things like a low dose of sertraline to help manage the anxiety on an ongoing basis. There are other drugs that doctors can prescribe. And again, you can check those out. You can go to the NICE guidelines and have a look at those. But some of those might be things like beta blockers that helps reduce anxiety and obviously has better outcomes. What we don't want to do, and I know this is a very controversial subject, we do not want to get you started on diazepam and natural or any of the benzo family's medications, because all we are doing is teaching you the way to manage your feelings is to take a pill. And the reality there is that inadvertently causes another health anxiety problem later down the line. Because the moment you start taking the stronger medications to manage your anxiety, all that happens is we end up with dependencies on them. If we then try to manage people on them, they get really anxious. And the reality is, you do not want to be emotionally numbed around taking medication for your feelings. So try and avoid. Do not go to benzos as an option. So please don't go to your doctor and say, can I have a diazepam? Because the reality is they cause more harm than good if they're not used properly. Now, that's not to say if you absolutely don't need them, the doctor will prescribe them. But try everything else first. Try the low-level meds, try the sertralines, try the beta blockers, try the distraction skills, try the self-help, try the breathing apps, because there are lots of ways in which you can manage your anxiety. Finally, then, just moving back to the risk factors. So risk factors around anxiety really goes back to that piece of trauma that we talked about. And the risks around anxiety could be the fact that you're going to have that panic attack, or you could dissociate. So if you've got a history of dissociation, that could be a problem. Equally, if you have trauma, what you might find is there is a chance for it to slide across a bit to PTSD. So that's the post-traumatic stress disorders. And that's where you go back into the trauma. So you feel it, you can hear it, and then that causes that trauma all over again. So we want to be able to manage anxiety safely. We want to make sure that your risks have been taken into account. So if you have got known risks, such as you dissociate, or you can go into this PTSD bit, then it is absolutely worthwhile getting that right help. Equally, the other risk around anxiety is self-medicating. And what we don't want you to be doing is smoking cannabis or drinking alcohol to manage your feelings, because ultimately it just comes back around and bites you again. Because whilst you may feel at the time it is a wise thing to do, I can absolutely guarantee you it is not. It causes dehydration, it causes negative thinking, it causes complications in health conditions. And actually, smoking and drinking increases the heart rate and therefore increases the chances of anxiety. All it then means is that you can put yourself in a situation where you have a panic attack whilst under the influence of substances, and that generally becomes quite a messy place to be. So we want to avoid all of that. So let's just summarize. So what is anxiety? It is a normal response to the feeling of fear. It's just based on scale. What causes it? Lots of things. Social situations, life experiences, trauma. Risk factors. So know about people's backgrounds and histories. Do they dissociate? Do they lose space and time? Are they a risk for flashbacks and PTSD? If they are, how do we manage those? What can we do to calm people and soothe people? And finally, what's the chance of them fainting where they're hyperventilating, and managing that? Signs of anxiety then: increased heart rates, nausea, sweating, shaking, spiraling thoughts. How is it assessed? The GAD-7, bit of history taken, and then that's assessed there. Natural ways of treating it: good sleep hygiene, good balanced diet, exercise, anything to reduce that heart rate to keep it nice and calm. Vitamins, again, omega-3s, vitamin Ds, and your Bs. If you want a natural way of treating this, again, rescue remedies over the counter and herbal stuff can work really well. Equally, incense and oil burners, anything that's got a calming effect. Other natural ways might be sounds, music, lights, and breathing techniques. If that all doesn't work, we're going to move down to medication options. And at that point, we might be taking an SSRI, a selective serotonin uptake, such as sertraline, and or a beta blocker to manage that as a PRN. So the SSRI is a long-term piece, or you might just ask for a PRN and as and when required medication. But again, that will be reviewed on a regular basis. What we know, the best treatment for anxiety is cognitive behavior therapy. So again, talking about it, getting to the root cause analysis and understanding where it originally came from. So thank you very much for watching. My name's Steve, and I hope you've enjoyed the session and you've got something out of it. And I look forward to seeing you in others. Take care for now.